Hello, and welcome to the first episode of Stamina Stories. Today, I have with me Dr. Priya Bansal. She's a seasoned dentist based in Bengaluru with 2 decades of experience. After completing her BDS in Chennai, she's also specialized in advanced prosthetic systems and endodontics. At Priya Dental Clinic, she leads a wide ranging practice combining cosmetic, restorative, and specialized treatments. Her patients often describe her as warm, professional, and deeply active in her care. I'm especially excited to talk to her today, not because of her incredible career, but also because she's actually my dentist. Okay, so let's just jump in with the first question. Where did you grow up, and what were some of the early influences that shaped your interest in science or healthcare?
Hi, Dia. Thank you so much for the lovely introduction. I grew up in Chandigarh in a very, very close-knit community where kind of everybody knew everybody. Like, it's like a very, very close integrated system, very protected as well. But funnily enough, I would say that for some reason, we siblings were always remembered for our dimpled smile. So that kind of subconsciously made us realize that how powerful a smile is. It's not only cosmetic. It kind of affects your confidence and how you show up in the world. So yeah, so that is how it is. And the other thing is, I always knew I wanted to be a doctor, but I was equally interested in art as well. So dentistry kind of became a very, very perfect calling. So it kind of allowed me to bring precision medicine with and together with creativity and hands-on skill. So yes, that is how I kind of, like,
Got it.
so that was the calling. It was a mixture of science and art. Yeah.
Got it. That's really nice. Who have been the biggest pillars of support in your journey? Anyone you'd call like your torchbearer to help you get here?
Hmm. So primarily, I would say it was my parents, my mom and dad. So yes, I think the first time I would have opened my mouth that I wanted to be a doctor. So they kind of laid out anything, everything possible for me to achieve that dream. Then it would be like there's so many of them.
Yeah.
Yeah, like I'll just tell you this one very thing that so I was kind of offered a medical seat, but I made a conscious choice. So people kind of thought that dentistry was a step down, but I and my parents, we saw it as a step forward. That because like in dentistry, you're not just treating teeth, you're diagnosing disease, you're relieving the pain of the patient, you're kind of restoring the identity and often transforming someone's confidence in a single appointment. So my parents kind of understood. Otherwise, generally it is like you left the medical seat and you took the dental seat. So first would be my parents. Then second, I am very, very lucky that I had amazing mentors in college, my professors, which kind of uh, instilled the confidence in me to be a health leader, like to hold someone's trust in your hands. So
Yeah.
yeah, so that is it. And primarily, I would say 2 decades of practice. It is my patients who every day don't make me think that dentistry is my job. They every patient which I treat, it kind of gives me a purpose. So yeah.
That's very powerful and sweet. Um, so I think you kind of answered this already, but how did your path into dentistry like shape come to life, and like was it I mean you've already answered if it was planned or not, but is there anything else about how dentistry came into your life?
Hmm. So I think it was dentistry. Like now, I would say 2 decades of private practice and before college. So we are talking about almost around 2.5, 3 decades old story. So it was more of dentistry was more of uh, curiosity and courage, where kind of passion took over more than the prestige. That is, I would like to say. And yeah, as I uh, finished my graduation, the certificate, higher certification. So, and through various training, I kind of saw that the power that dentistry had to instantly change a person's life. So it kind of like every day I believe that what was a planned decision, it just kind of became a purpose.
That's very nice. That's very powerful. Have you, like, you've been practicing for almost 2 decades. You've seen dentists evolve, right? But in what ways, and especially for women, have you seen any changes in the field from when you started to now?
Hmm. So yes, dentistry has definitely evolved. I would say the way I used to work maybe 5 years ago, that is not the same thing what the way I work now, because so many new things, so much of technology has come into it.
Yeah,
See, we work in a field of 1 millimeter, 2 millimeter, that kind of thing. Our work is super precise. So dentistry that way, like it's kind of a cutting edge medical science, which is very central to preventive healthcare. There is so much of more awareness that a lot of systemic diseases, they have oral manifestations. So your mouth is kind of your gateway to the body's overall health. Like looking at the mouth, we can diagnose that, what other systemic problems a patient could have. So that way, dentistry is taken as a very serious field now. And from the evolvement part, just imagine we have 3D printing for everything. We have regenerative material to grow bone and tissue. Like it is kind of the future of medicine. And then when it comes to being, what did you ask there? Being a woman in dentistry?
yeah,
How?
yeah. From now, I mean, from back then to now, have you seen any changes for women?
Yes, absolutely. Mm, I had two very strong, like, they were kind of our role models. They were the HOD of two departments. So they kind of, compared to the male counterparts, so they kind of instilled that confidence that, like for example, like medicine in general is not kind of a male language. It is a human language. You don't have to see yourself as a female in dentistry or male in dentistry. Like we women, we can bring in more of, like women bring in more of empathy. They bring in more of emotional intelligence. No, like no com. I'm not trying to demean anything, but it's like that kind of impacts our conversation with our patients. That kind of gives us more insight into what the patient is kind of want to do it. And mm, so it just gives us like uh, kind of more power to do good work. Yeah.
Yeah. That is very nice, very touching. Um, so have you seen, like your personally, have you seen being a woman in the field like as a challenge or an advantage or just simply part of the journey?
Um, no, it's kind of simply part of the journey. I wouldn't say that it's a challenge, because I would say like doctors as such are given a lot of respect by the patients.
Yeah,
So they do not the patients do not differentiate between a male and a female. They now the patients are so well aware that they would do their own research and come to you. And doctor in a profession is more of a word of mouth profession. So they already come with the confidence because someone has given them the confidence to visit a particular doctor.
yeah,
So that way, I would say yes, that not much of a challenge, but yes, like any other field, a little bit here and there happens. So, but one more thing is there, like in dentistry, especially, people come with the confidence that uh, being a female uh, will be more precise, will pay more attention to detail. So that way, yes, it and that raises the challenge as well because you are expected more.
Yeah, makes sense. Um, so looking ahead, what do you see for the future of dentistry? I know you talked about how it's evolved and how there's been so much technology involvement. Do you think that'll continue? What do you think about the future of dentistry? And do you see future opportunities for young women aspiring to be dentists?
Oh, the future of dentistry is amazing. I believe the way dentistry is evolving, the way the kind of new cutting edge technology is coming, it's amazing. Like there is no short word for it. It's just that uh, curiosity is your superpower. That is, I believe, how the dentist, how the tech around it is working. So anything and everything is possible, right from a simple cavity restoration, simple filling, what we call it in simple, in a layman language, to kind of for full mouth rehabs. Like it could be anything. It's the future is really, really bright. Like for during my time period, if I would say that there were seven higher certification branches, now those seven have split into so much of uh, the micro branches and everything. It's amazing. It's amazing. Like you can restore a person's smile in 24 hours. You can relieve the pain almost immediately. You can fix anything and everything. Any kind of crooked teeth, any kind of missing teeth, any kind of trauma cases. Yes, the future of dentistry is amazing.
I'm sure that response will be will make a lot of people hopeful. You can fix anything. So, this is the last question. What would you tell aspiring students, especially young girls, who are interested in science or interested in dentistry, but aren't quite sure about their paths or aren't quite sure about taking it up?
Okay. That way I would like to say to every young girl that just don't wait for permission to pursue what excites you. So, and when it comes to science, I would say if you're a girl who cares deeply, who pays attention to detail, and who wants to heal, invent, or innovate, so you already have everything it takes. So uh, the world just need more women like you to like just think. It just needs your voice, your ideas, and more importantly, believe in yourself. Believe in that you can be an amazing leader. So I think it's the most old saying what I always kind of follow. So don't just try to fit in, just stand out.
I hope everyone listening takes that advice. Oh, I do have a bonus question though. What's one myth about dentists or dentistry you wish people knew?
What's one myth about dentistry? Hmm. Um, okay, so I'm just I'm just trying to find out this thing. Yeah, the most commonly, I don't know for whatever reason, why people try to think that you get any dental work done and it affects your eyes.
Your eyes.
So yeah. For example, a wisdom tooth has to be pulled out. They would be writhing in pain, and but they will say, yes, it will affect my eyesight. You have to do a filling on an in the upper jaw, and for some reason I don't know where it started, how it started, and like I don't know why teeth are correlated with your eyesight. Yes, teeth should be correlated with the functional and most importantly a smile. Keep smiling and keep smiling pain free.
Okay, thank you so much, Dr. Priya, for being here. I had a really nice conversation with you. I hope you had a good time as well.
Yes, I did. Thank you so much, Thea. Good luck.
Thank